Hello, my name is Lisa Rose. I'm one of the community midwives, and this is just a short video to explain about vitamin K. After birth, an injection of vitamin K is offered to all babies. The reason we offer this is because some babies can have a condition called vitamin K bleeding deficiency disorder, and that basically means that they don't have enough vitamin K in their body when they're born to allow their blood to clot very well. So vitamin K obviously helps the baby's blood to clot, helps the people's blood to clot, and generally as humans, as adults, we get, or even as older children, we get vitamin K through the foods that we eat. But as babies generally have a milk diet, they can sometimes not get enough vitamin K in their body, and if they happen to be born with very low levels of vitamin K, then they run a small risk of having this deficiency disorder, which can then lead to internal bleeding into the brain, which can be quite fatal at times. 1 in 10,000 babies on average will have this disorder, which means up to about 160 babies a year can potentially have this disorder, which can then lead to become fatal if it's not treated. We don't screen for it, so we don't necessarily know which babies do or do not have it, and because it's such a small amount of numbers, it's not a screening test that we offer on all babies when they're born. But instead what we do is offer a vitamin K injection after birth, and that eliminates this risk to any of the babies who potentially have this VK BDD disorder. We offer it via an injection because it's just a one-off dose, and they never have to have any more supplements until they then start weaning and eating their own foods. We used to be able to offer it orally as oral drops, which they would have to have 2 or 3 doses depending on how you were feeding your baby, breast or bottle. However, research recently has shown that having oral vitamin K, the body doesn't really absorb it very well, so it has minimal effect on whether the baby has taken enough of that oral dosage in or not. So the injection is what's recommended for all babies. It is totally a parent's choice as to whether they do or do not want their baby to have vitamin K after birth. And if you are unsure or it's something you are querying, we do give all our parents a leaflet explaining about vitamin K and the reasons why we give it and the information about this disorder, but you can also do further research yourself, and you can decline for your baby to have it if you wish, but it is advised by our governing health bodies that all babies are offered and given this vitamin K after birth.